And now for the latest when it comes to COVID-19. From the north to the south, states are reviewing COVID preparations and measures. India has recorded 116 COVID cases within the last 24 hours itself, which is almost half of the cases compared to yesterday's 312 active COVID count. Now, with a majority of the cases being reported in Karnataka, 92 active COVID cases have been reported today, followed up by Maharashtra with 15 cases being recorded. Now, as the state of Karnataka witnesses a surge, the state government's cabinet subcommittee is set to meet today to discuss the recommendations made by the technical advisory panel on further measures to be taken to manage the COVID situation. Karnataka's Health Minister Dinesh Gundu Rao has also indicated that there will be no imposition of any restrictions and has also urged people to take further precautions. Another southern state, Kerala, has also reported 128 fresh cases of COVID-19, with one person tragically being reported dead within the last 24 hours. On the other hand, Maharashtra, the government is also boosting preparedness. The government has instructed health officials to ensure the availability of ventilators, oxygen cylinders, and other necessary equipment at all government hospitals. The active COVID case tally has crossed 4,000. And out of these, the highest number of JN.1 cases has been reported from Goa and Karnataka. This is followed up by the state of Maharashtra.
We were expecting JN.1 to be there. That's what we've been telling from day one. That JN dot variant is there, and we have to take precautions. And we had said that we'll be sending it for genome sequencing. Now we had sent many of our samples, and about 34 has come as positive. So definitely, I think more if we test, more we'll come to know it is JN.1. So that is not a surprising issue. That is expected only.
All right, we're crossing over to my colleague Neha, who joins us on the line right now. Neha, tell us more about what's taking place in the state of Karnataka, because it's witnessing quite a high surge when it comes to COVID cases. What exactly is the state government doing to ensure that they're fighting against this crisis?
Well, yes, in fact, we're seeing increased surveillance by the Karnataka government on the border areas between, Karnataka and Tamil Nadu and Karnataka and Kerala as well. What we're, of course, now picking up is that the testing too is going to be increased to about 5,000 cases. That was supposed to be done by Saturday itself. More importantly, we're also now seeing that, people, of course, have been asked to mask up. All aged above 60 have been asked to wear masks when in public. And anyone, in fact, reporting symptoms of COVID, whether it's a cough, cold, fever, fatigue, have in fact, been asked to get themselves tested and stay in home isolation until such time that this does not improve. But we really, of course, have to wait and see right now how, the cases, of course, are brought under control by the state government.
All right, Neha, do stay with us. We're also going to be crossing over to my colleague Shweta, who joins us now. Shweta, tell us more about the situation in Mumbai, and tell us more about the advisories that have been issued to the residents.
Well, that's absolutely correct. In fact, talking about the number of COVID cases which have been registered in the state of Maharashtra, firstly, we see that 28 new COVID cases have been recorded in Maharashtra, from which 13 cases are from Mumbai alone. Now, taking the tally to 77, the active cases which are prevailing in Mumbai, and 168 active cases in Maharashtra, out of which we understand that 10 cases are of subvariant of Omicron JN.1. And here we have also heard from the Health Minister Tanaji Sawant very categorically stating that one need not to panic, but it is the time where one must ensure to follow COVID appropriate behavior. Alongside, what we also understand is that the state health department has also laid down with the data on the number of availability of oxygen cylinders on bed, and also on the ramping up of the RT-PCR testing alongside genome sequence testing. Here, very clearly, one we see that there is a gradual surge in the COVID cases. However, there is not a sudden spike which is being reported from the state of Maharashtra or from Mumbai. But certainly, yes, there is a graph which clearly states that there is a time where there is a gradual increase, especially when this is the time where we understand this is a festive time, New Year celebration, mass gathering is going to take place. We are waiting so that the officials can come up with some guidelines. As of now, no guidelines have been given to the situation.
All right, Shweta, thank you so much for joining us and bringing us those details. So I'd also like to thank our correspondent Neha for also joining us and bringing us those details. With this, we're going to be shifting focus. No end to severe cold conditions.